Senator Whitehouse.
Thanks, Chairman. I think we know a fair amount about what works and what doesn't work. One thing we know is that fee-for-service doesn't work, and the quicker we move off fee-for-service to value-based programs, the better. We had some good experience after the Obamacare bill with the accountable care organizations, which have worked extremely well and enjoyed bipartisan support and been successful in red and blue states alike. So there's one. I think the other area, worked with Senator Cassidy on this, is that the specialists have too much control over what gets charged. And letting primary care doctors make more decisions and specialists make less about who gets paid what looks like it would reduce costs. We have specific experience in Rhode Island that confirms that. A third thing that is a real pain in the neck for people and also a cost driver is prior approvals. Why would you let an insurance company require prior approval before they let a doctor go forward with care that you need? And in particular, why would you do that when the doctor is not on fee-for-service, when the doctor is moved to value-based care? There's at least an argument that in a fee-for-service world, you could have doctors churning and churning and churning and churning the meter to run as much money out of their patients as possible by doing as many things as possible, but not curing the cause. And so to have an insurer look over that and say, wait a minute, this has gotten a little bit out of hand here, we're going to want prior approval, could arguably make sense. That's a separate argument, though. Once the medical practice is invested in trying to provide the best care at the most effective cost, and they're aligned, why would they want to run the meter? They get penalized for being over expensive. So I'd like to see us get rid of prior approvals for any value-based care and require prior approval from Medicare before any insurance company can require any prior approval. Let's have prior approval for prior approvals and get that nonsense out of the system. That's a huge part of that 20% overhead cost, which, by the way, was something that Democrats fought to reduce to 20% against pressure from the other side. But immediately we have a problem of people who have an immediate concern for their livelihoods and for their financial well-being. I talk a lot, Mr. Armitage, about Carla in Rhode Island, who is a retired mental health counselor, 60K annual income, doesn't qualify for Medicare yet, and gets her health insurance through our health insurance marketplace. Her premium is going to increase from $427 to $904, a 112% or $477 per month increase. That is an immediate problem that we can solve by extending the Affordable Care credits while we have this larger discussion about how to bring things down. Mr. Armitage, how do you feel about the problem of the individuals who are about to get whacked with a 100% increase because Congress has failed to extend these credits?
Well, I really appreciate the discussion about how we can improve health insurance in the future, how it can reduce the cost. I like what Senator Bennett had to say about nationalizing health care. But my immediate concern is January 1st, 2026, when my payment, my wife and I are paying $443 a month, and on January 1st, we will be, if we continue that, we will be paying $2,224 a month. That's 500%. So I would hope that we can fix this problem that we've had in this country for a long time. I used to have good insurance when I was a working carpenter. I couldn't continue that, unaffordable to continue that after retiring. My wife had good insurance while she was working. She can't continue that after retiring. It's too expensive. And now we're faced with very expensive, but we need time to make this transition, I think. And so
but you need a response before January 1st when your premium quintuples.
Exactly.
And Mr. Levitas, behind Mr. Armitage's problem is a problem of the healthcare system that is suddenly going to be starved of revenue. Nursing homes, hospitals, provider practices. What does that look like behind Mr. and Mrs. Armitage's problem?
Thank you for the question, Senator. So that's exactly right. Between these premium increases and what was in the reconciliation bill, we're seeing over $1 trillion of federal support coming out of the healthcare system going to providers, which is going to mean more hospitals closing and other stresses and disruptions in the system.
Known, right? We're doing this and we know it. So please, let's get this fixed before that happens. Thank you, Chairman.